In this video presented by Overpsyched, we will review borderline personality disorder. I'm Dr. Gerald Richardson, and let's begin with the objectives. We will start by discussing the diagnostic criteria for borderline personality disorder, then dive into some of the common features. We will briefly discuss defense mechanisms, then review the prevalence, development, and course of borderline personality disorder, and conclude with our current understanding regarding its treatment. The DSM, or Diagnostic and Statistical Manual of Mental Disorders, defines borderline personality disorder with the following diagnostic criteria: a pervasive pattern of instability of interpersonal relationships, self-image, and affects, and marked impulsivity beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. 1. Frantic efforts to avoid real or imagined abandonment. 2. A pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. 3. Identity disturbance. Markedly and persistently unstable self-image or sense of self. 4. Impulsivity in at least 2 areas that are potentially self-damaging. For example, spending, substance abuse, reckless driving, binge eating. 5. Recurrent suicidal behavior, gestures or threats, or self-mutilating behavior. 6. Affective instability due to a marked reactivity of mood, for example, intense episodic dysphoria, irritability, or anxiety, usually lasting a few hours and only rarely more than a few days. 7. Chronic feelings of emptiness. 8. Inappropriate, intense anger or difficulty controlling anger, for example, frequent displays of temper, constant anger, recurrent physical fights. And 9. Transient, stress-related paranoid ideation or severe dissociative symptoms. Now note, in the ICD, the diagnosis, emotionally unstable personality disorder, is used instead of borderline personality disorder, so the terminology may change based on which diagnostic criteria you're using. So now that we have the diagnostic criteria, let's explore some of the common features. Individuals with borderline personality disorder often experience intense fears of abandonment, and so these individuals are intolerant to being alone, and they need to have other people with them. The fear of impending separation or rejection can lead to profound changes in self-image, affect, cognition, or behavior. And these individuals display intense emotional responses to environmental triggers. Sudden changes in plans, even if unavoidable, can trigger panic. Individuals may undermine themselves at the moment a goal is about to be achieved. For example, drop out of school right before they graduate. And in order to avoid abandonment, individuals with borderline personality disorder tend to have impulsive actions. This may include self-harm or suicidal behaviors, gambling or reckless spending of money, binge eating, substance use, etc. Borderline personality disorder is also characterized by unstable and intense relationships. This may mean that the individual idealizes or falls in love with the first meeting, or they may switch rapidly from idealizing to devaluing the person, and they're prone to sudden and dramatic shifts in their views of others. Individuals with borderline personality disorder may frequently claim that the other person in the relationship does not care enough. And similar to their unstable and intense relationships, borderline personality disorder is characterized by an unstable self-image. This could be seen by the individual shifting their goals or values or vocational aspirations, and they may report that they don't feel as though they exist at all, or that they feel empty inside. A chronic feeling of emptiness is highly associated with borderline personality disorder. Individuals with borderline personality disorder have affective instability and marked reactivity of mood. For example, intense anxiety or irritability or sadness. And finally, individuals with borderline personality disorder may experience dissociation, such as depersonalization or feeling disconnected from themselves, or derealization where they feel disconnected from their surroundings, or transient psychotic symptoms in moments of stress. Next, we're going to discuss splitting. Splitting is a commonly observed defense mechanism in borderline personality disorder. Splitting was first described in object relations theory and expanded on by others, such as Freud. Splitting describes a person being unable to bring together the dichotomy of both positive and negative qualities of the self and others into a cohesive whole. These individuals tend to think in extremes, so here are some examples. Individuals who are displaying splitting may say the following: all doctors are terrible and all nurses are great. Or, if you're not with us, you're against us. Or, my mom is an angel, but my dad is evil. And also, these individuals may view news or history as either being a certain fact or a total lie. This type of behavior in defense to moments of stress is characteristic of borderline personality disorder. Now, there are many defense mechanisms, and splitting may be observed in other situations than just borderline personality disorder. But splitting is highly associated with borderline personality disorder. And if you're interested in learning more about defense mechanisms, there will be videos available on Overpsyched.com. So now that we have reviewed what borderline personality disorder is and some of its common features, let's discuss the prevalence, development, and course. So as is the case with other mental disorders, including other personality disorders, the cause of borderline personality disorder is not fully understood or agreed upon. Different types of abuse or neglect or a hostile conflict, as well as early parental loss, are very common features in those with borderline personality disorder, which demonstrates the role of environmental factors in the development of this disorder. The median prevalence is estimated to be about 1.6%, but it may be as high as 5.9%. It depends on the setting. The prevalence of borderline personality disorder is highest among psychiatric inpatients. The risk is about 5 times greater in first-degree relatives of those with borderline personality disorder, which suggests a genetic component to developing the disorder. Borderline personality disorder is predominantly, about 75%, diagnosed in females. And to discuss the course of borderline personality disorder, the impairment and the risk for suicide is typically greatest in young adult years, and it gradually wanes with age, and there may be a decrease in older age groups. Most individuals with borderline personality disorder will acquire more stability in their relationships during their 30s or their 40s. Some of the common comorbidities observed in borderline personality disorder are the following: depressive and bipolar disorders, substance use disorders, eating disorders, notably bulimia nervosa, PTSD, ADHD, and other personality disorders. These individuals may also develop physical handicaps, which typically result from self-inflicted harm. And unfortunately, premature death from suicide may occur. It's estimated that about 10% of individuals with borderline personality disorder die by suicide. And this risk is further increased if there is co-occurring depressive disorders or substance use disorders. So now let's transition into discussing some of the subtypes of borderline personality disorder. These are not described in the DSM, but Theodore Millen described a few subtypes that you may encounter. First is discouraged borderline. These individuals are submissive, loyal, humble, hopeless, and depressed. Next is petulant borderline, and these individuals are impatient, restless, stubborn, defiant, sullen, and feel easily slighted. Then there is impulsive borderline, who are captivating, capricious, superficial, seductive, irritable, and potentially suicidal. And finally, there is self-destructive borderline, and these individuals are self-punishing, angry, or high-strung. And now the final topic that we will discuss in this video is treating borderline personality disorder. Borderline is typically treated with psychotherapy. A modified form of cognitive behavioral therapy, or CBT, called dialectical behavior therapy, DBT, has the most supported evidence. Other types of therapy include dynamic deconstructive psychotherapy, or DDP, mentalization-based treatment, or MBT, transference-focused psychotherapy, and schema-focused psychotherapy. Now, this is higher yield for those of you who may be preparing for an exam. On certain psych exams, DBT is a commonly tested topic when discussing borderline personality disorder. Dialectical behavior therapy employs many of the components of cognitive behavioral therapy, but it also adds in practices such as meditation. DBT helps individuals with borderline personality disorder acquire skills such as emotion regulation, mindfulness, and stress tolerance. Now, the effects of psychotherapy are slow, and many individuals require years of work in order for it to be effective. In regards to medications, there is limited or no evidence of medication effectiveness. However, some antidepressants such as SSRIs, as well as mood stabilizers and atypical antipsychotics, are still commonly prescribed. And of course, if there are any comorbidities with the borderline personality disorder, such as mood disorders or substance use disorders, the medications may be more effective. This wraps up our discussion on borderline personality disorder. Thank you for watching, and for more resources, check out Overpsyched.com.